Across the country, the issue of law enforcement and police reform continues to grow. And today, we take a deeper look into this topic in the Grand Valley, specifically at policing and mental health. For the past 2 years, the Grand Junction Police Department has operated a CoResponder Unit, which brings one police officer and one social worker out on calls, responding to someone experiencing a mental health crisis. Fox 4's Adrian Thomas joins us live from the Grand Junction Police Department with a closer look at how well this program has worked. Adrian?
Jillian, the CoResponder Unit at the Grand Junction Police Department is made up of 4 people, 2 police officers with the department and 2 social workers from Mine Springs Hospital here in the Grand Valley. Now, since the CoResponder Unit's formation in 2018, it's responded to over 5,300 mental health calls and have only had to use force 3 times in order to prevent someone from harming themselves or others. An officer on the CoResponder Unit I spoke with says this is all about a shift in culture in policing when dealing with mental health crises. Christine Gregory has been on GJPD's CoResponder Unit since it was formed in 2018 after a grant from the state. It's a full-time job with the goal of getting people in mental distress the resources they need.
Depending on the day, it's hard to say. So there are, of course, days where you have 2 to 3 calls, if that, and then there are days where you go nonstop with 10 calls.
Gregory tells us each GJPD officer receives 40 hours of crisis intervention training, but the CoResponder Unit is designed to keep regular officers on the streets responding to criminal calls and go above and beyond with mental health care.
And unfortunately, here in the Valley, we have a really high suicide rate compared to the national average. Law enforcement gets the calls for these mental health and suicide, and it's just not something regular law enforcement is often trained for.
It's, again, really difficult, if not impossible, to expect a police officer to become a mental health professional.
Michelle Hoy is one of the directors at Mine Springs. She says the key to the CoResponder Unit's success is treating people on the spot. In fact, of the 2,000 crisis calls where the CoResponder Unit provided services, about 75% were treated at the site of the call.
Treating somebody in the place where you meet them and really being able to de-escalate a situation 70% of the time is a great statistic versus we're cuffing them up and taking them to jail or to the emergency room.
Back at GJPD, Christine Gregory says the goal is to avoid detaining someone unless absolutely necessary.
Everything from the beginning is your mannerisms, your tone, your body language, the words you choose, the way you interact with the subject. You tell them straight away, I'm here as a part of the CoResponder team. I'm not here for anything criminal.
Gregory adds, without this unit, use of force could be more prevalent.
The subtleties of the mental health side help outweigh that, and then you don't have a use of force incident that you didn't need to have.
Now, Mine Springs also emphasized calling Colorado's mental health crisis support line if you or a loved one may be in need of help. That number is 1-844-493-TALK, and we'll post that number along with this story to our website, westernslopenow.com. Reporting live at the Grand Junction Police Department, Adrian Thomas, Fox 4 News. Jill?
Thank you so much, Adrian.